Good morning friends, I am Dr. Anirudh and today we will be discussing about a common problem which affects people of all ages and from all walks of life. It is known as a fistula. So what is basically a fistula? A fistula is a communicating tract between two epithelial lined surfaces. A fistula can be either an internal or an external fistula. It can be a simple or complex. It can be a low fistula or a high fistula. The most common location for a fistula is usually the perianal area, and it forms because of infection or abscess in a anal gland which ruptures outside, which leads to communication between the perianal skin and the anal gland. So a fistula or an anal fistula usually presents with some pain, some pus or watery discharge and irritation in the perianal area. The diagnosis is usually suggested by the history and is confirmed by the clinical examination, which will reveal the presence of an external opening near the anus. This external opening may or may not extrude some pus or watery discharge, and on digital examination the tract of the fistula may be felt going upwards deep into the anal canal. Sometimes the internal opening can also be visualized with the help of a proctoscopic examination of the anal canal. When the fistula is very deep seated or when it is a complex fistula, we might require further evaluation with the help of a transrectal ultrasound or with the help of a MRI of the perianal area, which will reveal the entire anatomy of the fistula, the branching tracts and its course through the sphincter muscles. This will help in the further treatment and the decision making during surgery. So once the fistula is diagnosed, the treatment is mainly through surgery. We can try a conservative treatment of hot SIDS bath, antibiotics and some stool softeners to decrease the infection present within the fistula tract. But usually these measures by alone are not successful in completely curing the fistula. The fistula tract needs to be laid open, which is known as a fistulotomy, or sometimes the entire tract needs to be taken out by surgery, which is known as a fistulectomy. This kind of surgery is done by the open method, which means it is an open surgery removing the fistula tract from the surrounding tissues, and then the wound is left open to heal by itself by means of some dressings. The surgery itself can be done under regional anesthesia and the patient can be discharged the next day. But the complete recovery in this type of operation may take up till 2 to 3 weeks. Sometimes if the fistula tract is very superficially located or is small in size, this kind of surgery can also be done by means of laser fiber or by means of endoscopic surgery. This burns the tract or closes the tract from inside and does not leave any external wound. So the wound healing process is very fast and the patient makes a rapid recovery.